We're going to make a start, and I am going to first introduce the panelists, Professor Alafia Samuels, Mr. Neil Brennan, Dr. James Hospedales, who is on his way as we speak. I'm moving very quickly, and Professor Anselm Hennis and Sir Trevor Hassell. I have already identified the title of this, but this is really getting the multi-sectoral response and how the NCD commissions across the Caribbean region can use, we can use them to leverage private sector partnerships. And so I am going to start by posing an opening question to the panel. And I'm going to start with Dr. Hospedales, just because he's the last person to arrive here.
No pressure.
So what action do you think is needed to produce a more effective multi-sectoral response to NCD prevention and control in the Caribbean? Actually, I'm going to ask all the panelists that, so the others have an unfair advantage. Do you want me to repeat the question? I do this all the time with medical students. Okay, so repeating the question. So what action or actions are needed to produce a more effective multi-sectoral response to NCD prevention and control in the Caribbean region? And I am going to give you 2 to 3 minutes. Can you work with that? Okay.
Guided by you, sir. Good morning. What action? I think that action needs to be preceded by a little bit of thought of what does it take to achieve the targets that we have in NCD. And there are twin tracks that are agreed, all your primary prevention, population level moves, which we've talked a lot about, and your secondary prevention inside of when people have the problem, how do you find them, get them referred, retained, stay on their prescriptions so that they receive the benefit. And following that, I think the commissions need to have this clear, that they have what they're focusing, what the priorities are, and work with what we already have. So if you take this country, there's a large national health fund with 500,000 people or whatever the number is on the register. Look at how we can analyze that for the treatment cascade, and at each step in that cascade, as I was touching on yesterday, what is the opportunity for public-private partnership? If 20% of people with hypertension don't know yet that they have it, how can you educate them through NGOs, barbershops, TV, everything? So there's one partnership to get folks to come forward. When you reach you've been diagnosed now, how do you get folks to stay on the medicine, do their work? Well, what about a partnership that then has not only Ministry of Health and the local health center, but has the local telecom company that gives you cell phone credits for taking your medicine when you're walking 150 minutes.
Yes.
That has a pharmaceutical company that will take on that kind of approach, the appropriate kind of training. You're basically using a partnership approach to the chronic care model, landing it in the country. So I think that's 2 to 3 minutes used. Thank you, sir.
And if I could just push you to give 2 to 3 points to an NCD commission on an island, say Barbados, who is looking to form this partnership with the private sector, what would be your top 3 priorities? I know this is island specific, but I'm trying to get you to be as generic as possible.
Well, top 3 priorities. First of all, decide that that's what you want to do, which you've said, and be very clear about what, from a policy point of view, what are the targets and so on you're trying to achieve. So that can be inclusive. Don't invite just 1 or 2 bodies, but invite pharma, telecom, all the parties that are going to need something like this. That is one of the ways to manage conflict of interest. Third, do some pre-work beforehand to have a clear plan that you're engaging people on. So I could talk to you further about that.
It will certainly come from the discussion. I'm sure the audience is quite eager to get involved here as well. Professor Samuels, so the academia and research is often seen as this ivory tower type detached from reality, and this is definitely not the case in translational research occurring at the George Allen CDRC and the university. So I'm going to pose the same question. What actions do you think are needed to produce a more effective multi-sectoral response to NCD prevention and control in the Caribbean?
Thank you. So I think I'm going to take 2 tracks, a hard one and a soft one.
Okay.
I think that, we need to consider what is most cost effective in terms of what we want to do and the results that we want to see. And I think that legislation, taxation, and regulations are probably the most effective things we can do. Now, the question is, how do you work the process to make it actually happen? And how do you work the process to make it happen in such a way that the private sector, they're not going to be happy, but you want to do as much as you can to minimize the backlash. So I think it would be important to identify what I call the friendly private sector, because there are quite a number of people in the private sector who are our partners. They are not all the same. We have the good, the bad, and the ugly. So we have to, you know, run from the bad, work with the good, and with the others, we, you know, yes, not use a long spoon, yes, and massage. Yes. But I think we have to recognize that we need to be nuanced in our approach. And in some circumstances, we need to facilitate partnerships between the private sector. So for example, you have a bakery in Barbados that's doing good with the low salt and the, yes, cassava and all of that.
It's very near to you.
Behind me, yes. We're neighbors. Maybe what we need to do is to engage that bakery and get him or help that person to convene a regional meeting of bakers and get this spirited person who is successful in doing what we want to talk to the other bakers and have a session like that. And there are other examples in the region. There are people who do healthy fast food. Mm-hmm. Maybe we need to get them in a room with the unhealthy fast food and let industry talk to industry. How can I make profit by selling healthy fast food? I don't think we can say that because we have no credibility in this. I mean, we're not business people who are, well, I don't know, but, you know, I don't think most of us are business people who are making money and speak that language. Yeah. So if we can form those kind of alliances, I think that might be quite helpful.
And what is the specific role do you think academia plays in this conversation?
Well, we are actually going to be trying to do some of what I just described, because in the Port of Spain evaluation, as part of our country studies, case studies, we actually identified some of these friendly private sector people. And in the new project coming up, we are going to be using them, not use, but you know what I mean, engaging them, that's the right word, to see, first of all, what do they think about what I just said? Because that's my idea. I don't know if they think. Of
course, yes.
You know?
Yeah.
So engage with them, start the conversation, and try to use the friendly private sector to talk to some of the other private sector. Some of them are not going to come to the table, and you have to just, you know, move on without those. The laggards, they'll get with us eventually. But those who are ready or who are receptive, get their colleagues to talk.
So I guess academia really pushes policy at the policy level and getting those other stakeholders together. Yeah. Professor Hennis, from where you sit from the Caribbean, but now in Washington, D.C., what are your comments on this?
I still sit very much in the Caribbean, first of all. Now, I think the first thing is the what. What are we working on? We're working to prevent and control on communicable diseases. And this looks at prevention as being the main focus of how international public health agencies work. But it's not only prevention, it's also improving care in health system at the secondary level, as well as tertiary care, which is rehabilitation, palliation. So that is the what. And how can we work around the what is obviously a question. We have to have a very clear focus. Who can we work with? Now, this actually is not simplistic or straightforward either. We have this guidance known as FENSA, Framework for Engagement with Non-State Actors, that in fact sets some very clear definitions about the who we can work with. And there are various principles in terms of FENSA, in terms of our relationship must have benefits to health. It must conform with World Health Organization's constitutional mandates and the general program of work. It must recognize the intergovernmental nature of the World Health Organization and the decision-making authority of the member states. It must support the scientific evidence-based principles by which we do our work. It must also protect the organization from undue influence, and it must also safeguard and manage conflicts of interest. And there must be transparency in the dealings. So that therefore determines the who that we can work with. Now, there are some players that we can't work with at all, for example, tobacco, arms, etc. And what you're finding too, in terms of the new environment, in terms of the private sector, the private sector is not homogenized, it's very heterogeneous. So there's some elements of private sector which are trying to do their best to improve health, and others that are doing exactly what the tobacco industry did. To delay, to deceive, to obfuscate, to confound, etc. Exactly, circumvent, and to claim to work with you, but really not working. And I know that firsthand because sometimes I sit in my office in Washington and I have to meet, not engage, meet with these elements of the private sector. Look at you and say to you, you know, we have 500 product lines that have reduced sugar in 400 of our product lines, or reduced the use of sugar in our products by 5 trillion tons in the last 3 years. And they're very, very powerful. Some of these private sector groups could actually spend 7 billion euros in advertising per annum. So these are the huge players. So then who you work with, and Professor Stams gave examples of those who are trying to make a difference in a positive way, but there are many others who don't wish to make a difference in that way.
And do you think that the criteria that you've mentioned, which sounds like not like an exhaustive list, do you think that they present further barriers to who we can work with?
Well, that's exactly,
and is that acceptable?
Well, you see, that is exactly the challenge that we face now, because, you know, too far left is right. Yeah. And certainly now, the whole basis of FENSA was developed by the member states, which basically is the organization. And they were very, very strict. And in fact, what is happening now is that I think there probably needs to be an alignment in terms of what the practical realities are, because the constraints are so tight now. Yeah. It almost constrains you from working with private sector to some extent, which is the unfortunate downside. We've had some very good relations that we've had to put on hold because of the interpretation of what FENSA might mean. So there are some of those challenges too. But I think we're trying to find a way. I think over time there'll be a balance in terms of what actually can be done in the interest of public health.
Sure. So we have some inherent barriers.
The integrity of the organization.
I'm going to go to Prof last. You continue. Sorry. We only have one mic on stage, possibly because I'm walking with the other one. So.
Good morning, everyone. So I'm here as a private sector company, but not a private sector company that makes products that impacts people's health and things like that. So I'm coming at it from a perspective of a company that employs a lot of people, and obviously the health of our employees has an impact on our business and our profitability. So yes, for me, there's a couple of things that are important for private sector organizations. One is that you have to be mindful of getting the right balance between giving people personal control of their own lives and taking personal responsibility for it. So in the private sector, you always have that kind of attitude that, you know, you employ people and people are there to do a job, and you're not there to nanny them or to manage things for them. It's their personal choices and their personal responsibility, both in their health, but also in their career and that kind of thing. And I think the biggest thing that needs to be focused on is changing people's attitudes, because there is a level of complacency around these types of issues, in the sense of people don't think anything's going to happen to them. If there are risks associated with their lifestyle and how they live, then they want somebody else to manage those risks for them and mitigate those risks for them. And then if something happens to them, then they want somebody to deal with it for them. So you need to get the balance right there, I think, between helping and making things easy for people, but not taking away the overall responsibility. And also, as an employer, the other balance that you have to make is, if you are, you know, promoting a particular thing, whether it be the bakery example, you know, this bakery has healthy food, so everyone should use that. All the other bakeries could be your clients or your customers, so you can't alienate them. So that's kind of the balance that the private sector companies have to do. But for me, there's two things that I think would help. One is a coordinated and consistent approach to messaging. There's a lot of conflicting information out of there, and people get information from so many different sources, and it's not coordinated, and everyone puts their own spin on it for the right reasons, whether they are a company selling a product or a health insurer or whatever it might be. You get told different things, and as an employer now, I'm trying to support my 3,000 staff all across the region, and they're all getting different messages from different people. So if we could be better coordinated around the messages we give and consistent around that. And I think the other thing is to really focus on how we can make things easier for people. This is especially on the prevention side of things. And I don't know what that would look like. And I'd be happy to partner with people and talk about some of those things. Sure. But if you're looking at, let's say, I don't know, cancer, early detection is obviously the best thing that you can do, other than change lifestyles to prevent it. And there must be many, many things that we could do together to make that easier, whether it be, you know, let's work with the government, employers, health insurers, and all the rest of it to come up with in Barbados, let's say a bus that goes round and tests everybody. You could get around many, 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 many people. And as an employer with a lot of staff in Barbados, we would be quite happy to financially support that, as I'm sure, you know, the health providers would, the insurance companies, because it makes their businesses more profitable. So I think we need to be a bit kind of bolder in our ideas.
So you've raised two very interesting points, and I want to be provocative because that's what they pay me for. So the private sector, you said there's a balance between how much is the responsibility of the individual employee and how much is the responsibility of the company. Now, some people argue that's kind of a cop-out from the company side. It's not our responsibility, it's the individual. What things do you think are the minimum standards a company should put in place to make the environment enabling?
That's a very difficult question. And it's very
dependent,
and it's very dependent on the type of organization, I think, as well. For a general employer like us who don't provide healthcare products or foods and things like that, then I think for a good employer, a minimum standard would be to have some level of health cover for your
health cover
for your staff. And again, that depends on what market you're in as to what kind of state healthcare is there and all the rest of it. But you need some level. I think you need to promote as part of your, I think you need a wellness program, you know, and that can be very simple. That's just around education.
Wellness program, good.
A big part of that should be all the preventative stuff, and you can work with all your healthcare providers because they're quite happy to work with you on that, and it's not expensive. So as a minimum, you need to do that. And that's probably the two things that I would say. It becomes more difficult when you start saying, you know, we should promote this and we should partner with these kind of people.
The mic, we're going to use the mic. So I'm going to ask Prof to give an opening statement, but here's my second provocative question. If you had a magic wand, what would you say to government to make this easier for private sector? Because we heard, I think on the first day or the second day from Mr. Clark, you know, there's a big barrier. We want to work with government, but government, it's too challenging to work with them. So if you could just erase all of that, what would be your top 3 things? And I'll move to Prof and let you start off by responding to the open question. Thank you.
I was trying to signal you and encourage you to keep that discussion going because it's such a unique opportunity. And so, you know, so we've spoken about a multi-sectoral approach to this issue. But there are 2 issues that have always concerned me from a civil society perspective. The first is, throughout the world, we really have not put effective mechanisms or platforms in place to deliver on this multi-sectoral approach. So we have spoken about commissions, but for the most part, as Katie mentioned during our meeting yesterday of chairs of NCD commissions, for the most part, throughout the world, these platforms are really not effective at all. For the most part, that's an overarching statement. So for me, that is the first issue that I think that there really needs, both at the national, the regional, and global level, for there to be a significant investment in terms of producing the multi-sector. And then finally, and just my second point then is, which is to some extent related, we speak so glibly of this multi-sectoral approach.
Mm-hmm.
And
sounds good.
yeah, absolutely. And you know, very often in this, we point a finger at the private sector. But you know what? Governments with the multi-sectoral approach. The private sector doesn't understand. With all due respect, very often the public health agencies do not understand, or an experience of working with in a multi-sectoral approach. And then I could go on, but I'm gonna leave it like that because I wanna keep those two fundamental points there. Martin wants to speak. Go ahead.
Sure. We have a question for the audience. We've opened up the audience for one question.
I just can't keep quiet.
No.
Good morning.
For now.
Let it go. Let it go.
Private sector. And this is an issue facing every sector. How to get the private sector involved.
Mm-hmm.
We faced this issue when we were trying to deal with the new strategic plan for Cardi. So I went and met with the private sector. Grace and Massey and whatever. They said, listen, fella, first thing, you gotta show me the money. Right? Next thing, you gotta deal with risk insurance in the sector. Right? And particularly pre larceny.
Go ahead.
And then they also said, listen, you need to ensure that there's less government footprint in this matter for us something to go forward. Let me now come to an example. Coconuts. We're dealing with this regional coconut project. So what we started off with doing is setting up an innovation platform in each of the 9 participating countries, where we got a big private sector, small farmers, government, farmers organizations on board. The driver there is, okay, we want a win-win situation. Everybody's supposed to be making money from this matter. So the last piece of the puzzle is that we just completed an investment analysis looking at fresh coconut water, pasteurized coconut water, and planting material. We ain't even touching coconut oil and them things also. Put before them. But in addition to putting before the private sector to say, look, we can make money at the enterprise level, whether we are big or small, we're doing 1 hectare or 100 hectares. We also generating information that goes to government, which says, if this investment occurs, 150,000 acres of coconuts in Jamaica, this is what it's going to mean to employment. This is what it's going to mean to your gross domestic product. So we need to be talking those languages if we expect to hold the attention of these people going forward. Thank you.
But what kind of pushback? I'm glad you're on the floor. What kind of pushback did you get from the private sector?
No, they're at the table. That is the issue. They're not outside.
What were some of the responses you got to those challenges?
Very, very positive.
Very positive. Okay.
Up to yesterday, I think I saw one of the biggest coconut producers, who also happens to be chairman of the banana board here and everything, and they're excited because of the possibility of everybody winning, because everybody's at the table addressing this matter. Our challenge with chronic non-communicable disease is that we need to do the same kind of innovation platform. And there's a mechanism which the private sector themselves use on a daily basis for helping to drive their businesses forward. Thank you.
Mr. Brennan, does that help you with one of your barriers, perhaps?
It's interesting, I think. I think in the main private sector, organizations would be happy to be involved and would be happy to be part of things. The issue is when you think about how they run their own businesses, it's very dynamic, it's very fast. Again, it's all about, how much is this going to cost? What are you going to make from it? So it has to make sense to you to take part in it. And if you're going to get involved in something and support something and you get bogged down with a whole load of red tape and discussions about things and no action happens for such a long time, then you're going to shy away from it and you're not going to want to be part of it. So if you can, you asked the question, if you could, wave a magic wand, what would you change? You would change 2 or 3 things. I think one thing you would change is the kind of all the barriers that are around there and all the things that constrain what you're doing and allow people to get on with things much quicker. And the second thing would be, as a company that's trying to make a profit, then you would want some kind of tax breaks to help you, put some money into that to support it. Because then again, everyone wins with that. The government loses a bit of revenue, obviously, from the tax breaks, but they would get benefits in other ways.
So that's an extremely diplomatic response from the private sector, but you're really suggesting bureaucratic inertia coming from Caribbean governments. I'm going to move to Professor Hennis.
Yeah, I'm going to take out a comment raised by Sir Trevor about even public health institutions not necessarily knowing how to work in a multi-sectoral environment. And the reality is that, the Pan American Health Organization started in 1902. It's the oldest public health agency in the world. And it's always worked multi-sectorally. And the example is very simple: water and sanitation. Water and sanitation. And what has happened since then, more recently in our time, has been something like the revolving fund, which procures vaccinations at a very good price, at an ideal price, which then allowed, for example, the Caribbean region to eliminate various vaccine preventable diseases ahead of the rest of the world. So the populations benefit, the organization benefits, and their winners and the companies benefit. So it's a win-win-win situation all around. So the question is, what is different with non-communicable diseases? The difference is that many of the noxious substances that cause non-communicable diseases are man-made, man-manufactured, and the outcomes on health are the final common pathway of exposure to what man produces. For example, junk food, tobacco, et cetera, et cetera, et cetera. So therefore, if you're going to have an approach to this now, it results in a zero-sum game. There are winners and there are losers. And to preserve market share, you come across issues such as conflicts of interest, because someone is going to lose if you implement what you have to implement to save lives. And that is the difference and the difficulty with non-communicable diseases.
You're suggesting that the multi-sectoral response is completely different for communicable versus non-communicable.
Yes.
And which one would you say is you said PAHO has done the communicable bit?
We have very successful models that have allowed us to be at the forefront of the world in this region.
So can this not be translated, or you don't think it's...
The difference is that in non-communicable diseases now, you're trying to tell companies, your products are killing people, stop it or change it. And it affects bottom line. And therein lies the challenge.
Sure. Dr. Hospedales, and then we'll open to the floor.
Yeah, we need...
I attempted yesterday in my analysis to identify a range of partnership opportunities with the private sector, and some contain high conflict of interest that we should stay away from. But I submit, I don't accept Anselm's answer entirely. If you take that analysis a little further, there are a lot of areas with companies, that even some of them are not doing the best of things, where you can partner. To take dietary salt reduction, you can partner with a company because there's no individual company is going to lose much market share if everybody brings it down. The population impact is good. And the health folk need to convene it. While I have the floor, something that was mentioned earlier by our private sector colleague, if there's a lot of talk going on and nothing's happening, he gets fed up. And I read a case study recently entitled Conflicting Cultures. It was a case study of a partnership between a UN organization and a country. And the company, they value time and money differently from the UN system and the public sector. So that really needs to be paid attention to.
Thank you very much. And if you think we were provocative, wait until you hear this question. It's to Professor Hassell.
So I've achieved my objective.
Right. So you know what I'm going to ask. I'm going to try to dig a bit deeper. Because,
yes, do that. No.
I think the Commission in Barbados, we have had uninterrupted leadership for the Commission in Barbados for 10 years. The Ministry of Health, if you step back, the Ministry of Health could not have achieved a lot of the issues in NCDs, but you have to step back because it's not occurring overnight. You question the role and its usefulness, and I would imagine you're saying it from the perspective of we need to be introspective and we need to look again as to what are the other options. Are you suggesting, for example, that NCD commissions should no longer report to the Minister of Health because that door is not being opened? Are you suggesting that this be kicked up to another level as to the Prime Minister's office? And those types of things, because I think we have championed the whole issue of commissions within the region.
Sure.
And and Barbados has been a seed to this type of development. So I want to hear your perspective. Thank you.
So really the point I wanted to emerge is quite the contrary to what I may have conveyed. What in fact I was trying to convey is that we need to invest more in NCD commissions. And by invest more, I'm not speaking of financial investment. I mean invest more to make them more effective instruments for change. And while I'm just going to speak for 2 seconds, because I think it'd be very important to try and get as many persons to make quick comments as possible. One of the other issues in this multi-sectoral approach is the language. I speak a completely different language to Neil. And when Maisha and myself, when we were going to make a presentation to him, we spent ages changing and shifting and adjusting to meet his language so that he would understand our language. Whereas if I was going to Alafia, is a complete, and that's another issue that isn't being discussed and appreciated as far as the multi-sectoral approach is concerned.
Yeah. Okay, thank you, Prof. And that's very interesting because I've been moving around the room.
Yes.
Between mobile phones going off and.
So may I ask a question, please? May I have some comments, please? Thank you for facilitating the panel not going on a frolic of its own, because we really need to get people to make comments and so on. So basically, I have 3 points. One, Prof, I think what we are missing here is an understanding of the culture of public services across the region. I do not think that there's, the challenge is yes to come together, but the whole culture of the public service in terms of the Ministry of Finance and things of that nature, how they work from the colonial past is part of the difficulty. And we have tried to have public sector reform for years now and it's not working. That's one. 2, I disagree with my good friend Alafia in talking about run away from the bad. Let us engage the bad, even if we do not do it confrontationally. We can do it on the golf course, in the cocktail rooms, where the circumference of the waist is usually enlarged. We can do it at the different dinners. It doesn't have to be formal, or doesn't have to be official. And I also think academia can help in terms of research and grassroots research. But not only the research, but the dissemination of the information, because the practice we have had across the region is what I would like to say as intellectual masturbation. What we do is keep the information to ourselves, and we say, this is mine. We do not share it. Part of the culture of the public service, part of the culture of how the Caribbean operates as well. Until and unless we break those barriers, we will continue to have consummate difficulty moving forward. Thank you very much.
Thank you very much, sir. And actually, living in an academy, the concept of intellectual masturbation is very much there in my mind. I'm going to let Professor Samuels respond.
Thank you. I'll be quick. I think we have a finite amount of energy, and I think that we need to spend our energy initially interacting with people with whom we will get a result. Down the line, of course, you have to engage with everybody, but initially, you know, engage with your friends and form some networks and get some strength and get them to understand what you're doing. In terms of sharing information, I have advertised my website several times, and I can advertise it again. I think that there is a change of culture. There is more of engaging for transformation. And I think that the academics in this room are examples of that kind of new culture. All the work Nicole is doing is about outside work. It's not internal work that she's doing with NCDs and the law. She keeps telling us what to do and all of that kind of thing. And that's the, yeah, she does. But that's the kind of thing that I think that we need to do more of.
But do you think the skill set is even within academia, or do you think we should be looking for an external party to help us market these sound bites and information that we're giving to the public?
So actually, we were fortunate on our last project to be able, with the help of HCC, to employ a public information and communications officer, because we don't have those skills. And I think that kind of a person is essential for academia and for civil society, because sometimes civil society doesn't have the communication skills either.
Yeah, of course.
Yeah. And we need people with the skills.
So
we have another question,
just
Nicole.
Two quick follow-ups. So in terms of what Sir Trevor was talking about with the multi-sectoral approach and speaking different languages, I think that's absolutely true. But I think exactly what you're saying, by having everybody engaged, that's how we get to learn each other's languages. Because I'm able to explain as a trade person and as a lawyer where I'm coming from, and you get to explain from your public health. But we need to interact, and what is happening is we're not interacting, and so we don't get to know each other's languages. It's not impossible. We need to just talk to each other. And just quickly on picking up on the 2 points, so wearing my sort of University of the West Indies hat, just to say that I think the university as an institution is getting more and more sensitive to the points that you have raised, and our current strategic plan speaks to agility, and it has 3 A's and one of 3 pillars, and one of the pillars is agility, and agility speaks to exactly that. The need for the university to engage more with its stakeholders, to ensure that more of what we do in the university reflects the interests and the values of our stakeholders, so you all feel that you get value for your money in terms of the investment that's made in the university. So we're not quite there yet, but to say that it's definitely on our agenda, and that's our current strategic plan that runs to 2021. So watch this space.
So we have another question here, but you know, I am so surprised that this audience has let the NCD commission thing fall. I mean, Kenneth, you tried to push it, but here we have the chair of the NCD commission saying, well, look, we don't have enough bite. I was just curious, are there any other models in maybe in Jamaica where these types of organizations report to higher levels, or Guyana or anywhere in the Caribbean? Can anyone else speak to that? No?
No.
In response to the whole issue of, I think, was it Millennium Development Goal or whatever it is, dealing with hunger. One of the things that FAO has been canvassing in this part of the world is the whole issue of a parliamentary front against hunger. Where you're talking about, I think it's Antigua, I think it's, and perhaps St. Vincent are probably 2 examples of where the thing there's been some initial action, where you're really moving the thing to that level, where the NGO community, etc., this stakeholder platform is really engaging at the level of the parliament. And I know that there have been a couple of meetings that they've had. They had a meeting in Antigua, they had one in Guyana, where they brought speakers of the House, ministers, etc. And maybe that's a mechanism and thing that we can look to explore.
Speaking directly to the parliament? Is that what you're saying? Yeah. Okay. Another question?
Yes, just quickly to say that in the Jamaican setting, when we had set up the NCD committee, it was really reporting to the minister within the Ministry of Health. One of the issues we found at the end of when we evaluated after 2 years, was one, that we need to have done some capacity building at the beginning of every single member so that they understood what we were talking about in general because of the language. And then 2 was the need for the highest level of participation. And 3rd, the barrier to that was really that. And this is my question, and to you, the panelists, that we are talking about NCDs here, but we could have about 35 distinct public health programs, or even more, including those programs that the other ministries have. And sometimes setting up one committee for NCD, another one for there, I mean, the numbers, you'll find the same people in 1 week, or maybe in 1 day, seeing each other at the same meeting in the same venue. So how do we navigate that? We're looking at many different ways of doing that. But how would you recommend that we navigate the competing priorities?
Thank you. Who's going to take this from the panel?
I can take it very quickly.
Sure. And then we have one more question.
So you're asking, so
Yes,
I can take that by simply saying that the point is well taken, and that in small nation states with, limited human and financial resources, it's quite appropriate and would be quite appropriate to have wellness commissions, if you will, or some other similarly titled for the commission or committee. Because if in truth and in fact, recall that even in the heads of government's declaration, it did speak to NCD commissions or equivalents thereof. There we have it.
Yeah. Brennan, I'm not even sure why I'm asking you this question, because it really takes you from private sector to dictate to government. And a question from the audience is, well, what is the minimum that government should be doing to provide an enabling environment for employees? We're putting a lot of pressure on the private sector, but what should government be doing?
Not pressure. We're using the opportunity to have you here.
Just before I get into that, I just wanted to make one comment about a lot of the things that have been raised here. And I think that is that the private sector is not too different to all of these other bodies, because you're talking about, you were talking about one of your pillars is agility. So is one of ours in our company. Somebody else was talking about sharing of information. You learn through when you do lots of, studies around business practices and all the rest of it in the private sector over your career. Sharing of information is one of the key things, and you need to free people up and let people share information, and then your organization is more successful. And so we're just maybe a bit further ahead on the journey around those kind of things. So a lot of the themes that you're all talking about are, resonate very closely with me, and they're what we do anyway.
What are you going to tell government?
What am I going to tell government? So this is personal views, not my company. So let's
small family here.
Make sure that that's out there.
That's your disclaimer, okay?
I think it's probably two things. One is that you need to speed things up and speed up the things that people are asking for and the things that people need support with. Everything takes too long. And I mean around everything there. So whether it be something that we're partnering with some other organization on, that we want to, put something in place, then you need to, the bureaucracy that you have to go through to get that done is too much. And it's for the right reasons, don't get me wrong, they want controls and they want checks and balances. So they have to do their due diligence. So I'm not saying that they shouldn't do that, but it needs to be made easier. And I think the other thing I would say to them is put things in place to make it cheaper for us to do the things that we need to do that are not necessarily for our own, organization's benefit. They're for the benefit of the people in the nations that we are working with. You could just see it I can see it in my mind if we were saying, let's all partner together and do this mobile testing unit that can go to offices and test 300 people in the one day for all these different things and all the rest of it. We would buy the bus. It would be bought from, somewhere overseas, we'd then have to pay import duty on it, and then you wouldn't get any tax breaks for providing all the supplies for it going on an ongoing basis, and all those kind of things, and it would just end up being much more expensive than it needs to be, and it's not for our benefit.
So two main sound bites, really: time and money. Two precious commodities. Okay, so one final question.
Well, not necessarily a question, but a comment, in that with regards to Professor Hennis and the public health approach with communicable disease as opposed to the chronic non-communicable disease, we are aware that not all the gains were as a result of immunization and vaccines, but as a result of the development and improvement in housing condition, water supply, and all the rest of the things that go along with that. I think the approach that was used, if we can use that same approach with the non-communicable diseases by improving the lives of individuals, of communities, with those approaches, like we mentioned, the intersectoral health in all policy approach, and improving those conditions, I think we can make some headway as well with the non-communicable disease. And of course, including the worksite wellness programs and making the worksite environment appropriate and conducive to health, like for instance more standing and than sitting, because we know and hear that sitting is the new smoking. Don't know if we have heard of this. Yes. But you know, those kind of things in the workplace can make a significant difference.
Thank you very much. And one final comment from the center of the panel.
Yeah, I think
Professor
the points
Hennis.
you make are very important points. A lot of things took place that allowed us to make a big impact on the communicable diseases, for sure. But what we're finding now is that there's resistance and opposition and conflict to trying to tackle the non-communicable diseases and the root cause of non-communicable diseases. You're getting resistance to the manufacturers of these products that harm health. So there is a very different model to what allowed us to make progress in the communicable diseases. That is the unfortunate thing. People are losing money if you make impacts and have to reformulate and they have to stop producing tobaccos, et cetera, et cetera, et cetera. It's a very different model, unfortunately.
Thank you, Professor Hennis. Ladies and gentlemen, would you
Mr. Moderator, can I ask one question, please? One small question. I beg of you, very small, to the private sector gentlemen, just something that came to mind. What would be your advice on tying tax breaks to health-related benefits, particularly the NCDs, going forward? What's your advice on that? Is that a good idea? Is that something that we can look at and speak to our governments about?
So 1 minute response, because this was an afterthought. Good.
Well, it's a very quick response. Yes, it is something that's worth taking forward, and it is worth talking to governments
and
around that.
This sounds like
Absolutely.
a lunchtime conversation. Ladies and gentlemen, please join me in congratulating the panel.